You're listening to Autism Talks on KFNX News Talk Radio 1100. And we're very pleased to have in studio with us from the Advanced Vision and Achievement Center, Dr. Neha Amin. How are you doing?
I'm good.
Excellent. Now, Advanced Vision and Achievement Center has been practicing since 1982. They strive to provide optimum care and satisfaction to their patients, which they consider their family and friends. They go beyond 20/20 to evaluate and improve total vision. Their comprehensive and unique multidisciplinary approach offers problem-solving vision care for the entire family. Well, Dr. Neha, can you tell us a little bit about yourself and describe what you do?
Basically, the difference is I'm a behavioral optometrist, which a lot of people term as functional, meaning we don't just talk about 20/20, as you said.
Right.
So we're thinking about what you're doing during your day and figuring out what we can best do to improve your vision in all aspects.
Wow.
Now, how is the exam at Advanced Vision different from most eye exams?
Most of the time when you get your eyes checked, you're finding out, if you can see 20/20. Are you nearsighted, farsighted? Do you need reading glasses? That type of thing. And then also sometimes getting your eyes dilated and making sure that health-wise everything's going okay. The step further that we go is to work on binocular vision, the way those eyes work together, how your tracking is, how that affects the way that you function on a day-to-day basis. So when you talk about students, the way that they learn, when we talk about athletes, the way that they track a ball or that type of thing. So
keep your eye on the ball.
Yeah.
So how is it that autism affects vision?
As you all know, because you're very familiar with autism, but it's a neurological disorder. So it makes it difficult for kids to respond to and then process information from all the senses. But vision is one of the main impediments to them functioning on a day-to-day basis. So a lot of times these kids have really poor visual attention, meaning they can't stay fixated on something for any length of time. So the behaviors that everyone's familiar with is they scan a room a lot, they don't look right at you, don't make great eye contact, and if things are bright or shocking, they have a hard time focusing on them.
Yeah, right. Their senses, the way they perceive all the different stimulus is like that. My son does that. He'll kind of glance at you from the peripheral and do things of that nature, or if it's too bright, or it used to be when we would go into some of the like a Chuck E. Cheese type of atmosphere, that it was the stimulus was just too great on his vision, and he just wasn't able to be in that environment for a very long time. It actually would agitate him to be in that. He's actually gotten better over the years.
Much better.
It's true. And a lot of times if you reorganize a room or they go to the same situation, they're in the kitchen every day, and that's fine. But if you move a table or something, it's difficult sometimes for even those small things.
Actually, I move the furniture a lot, and he's really cool with it. He likes it because I give him new ways that he can bounce all around the house. So he's
probably
pretty good with it.
Visually, developmentally ahead of a lot of kids that we see. So some kids, that would throw them for a complete loop, and other kids it's more challenging and it's more fun for them that way.
Well, on that same line, what effects do these vision problems have on autistic children?
Well, one of the main things is we're trying to work on improving the way that these kids learn. So they're trying to process things peripherally, as you mentioned. So instead of looking at things, however, they tend to either look to the side of things or they're constantly scanning back and forth. So obviously when you're trying to learn the alphabet, read, things like that, that's very difficult for them if their world is constantly in motion.
Exactly. Mm-hmm. Now, I know that you have a different approach over at Advanced Vision and Achievement Center. Do you have a very high percentage of autistic patients that come into your center?
We do everything. So we do definitely see primary care patients. I could see you and your son, but we have a complete vision therapy department. And of the children that are coming in, mostly children, some, adults with head injuries and that type of thing. But of the vision therapy department, I'd say at this point, we're between 20% of our practices.
That's a pretty large percentage. I mean, when you consider the population in general, and it's great what you're doing because you have to do things differently. It's something that we talk about on the radio show quite often is you have to take a different approach when you're dealing with the special needs community. And the
and
standard
each child
quote
individually too.
Exactly. And so what you're doing over at Advanced Vision and Achievement Center is really, really great, and we really appreciate it.
Now, what can we do to improve their visual system for
Well, the biggest thing is to get them the help that they need. So a lot of times these kids, they're maybe doing certain therapies, but vision is often ignored. It's not publicized well enough, and that's probably our fault more than anything. But we're trying to do a good job of community outreach, just as you guys are with autism in general. But the big thing is to get them in, get them checked, and
Right.
find out what parts of their vision really are affecting them.
Because I know over at NMTSA is that they actually, Suzanne talked about this. I had talked to Suzanne a few weeks ago, and she said that a lot of parents don't understand that a visual problem might impair their learning ability, and it might just be as simple as a visual problem.
Right, and we actually work with Suzanne a great deal, so we have a lot of patients that go to both places, and it's right. If they're able to process what they're working with, it's less stressful, and it's
Less frustrating for them.
It's less frustrating for the children. It's less frustrating for the parents in general
Yeah,
too.
right.
And these kids, a lot of times, are very intelligent. It's just a matter of putting things in visual perspective for them to really be able to process them and soak it in the way that we do. Well, the way we take for granted that we're able to do.
We totally take for granted.
Well, you kind of already alluded to this, but do you work in conjunction with other professionals when treating autistic?
We work, as I mentioned, with the music therapy. We work with a lot of occupational therapists and physical therapists also.
Okay.
So a lot of the kids, when you think about a visual problem, a lot of these kids are really tactile, so they lead by touch. So that's the behaviors that you're familiar with. But the hand-eye, crossing the midline, those kinds of things, the occupational therapists are phenomenal with. And the nice thing is we can kind of work together to package and really treat that kid
Collectively
as a whole.
understand the child and his or her learning development. That's really awesome. That's awesome. So do you actually do the vision therapy at your place?
Right, at our office.
Okay.
So the
Definitely.
OTs and the PTs and such, they come into your facility?
No, we have ones that we work with that are really close to us. So we definitely correspond a lot. And a lot of these kids, like you were saying, it could be a 30-hour-a-week therapy
Exactly.
regimen. So we definitely want to maximize as much as we can, the time that we have. So we don't want to repeat what other therapists are doing and vice versa.
Excellent. Well, we really appreciate you coming on the show. Where can our listeners find out more about Advanced Vision and Achievement Center?
We have a website. It's advanced-vision
.org.
.org. Sorry.
Yeah.
And the phone number, we have two different offices, one in Scottsdale, one in Phoenix. The phone number is 480-483-0711. And then the other phone number is 602-863-2223.
Good job.
You did.
Yay.
You were
Thank you.
phenomenal.
Yeah, you were
And
good.
by the way, I know that you're expecting. When is your due date?
March 31st.
March, right around the corner.
Spring baby.
Yeah.
Excellent.
Spring
Well, we
baby.
wish
Better than
you
August last time.
and your growing family the very best, and we'll hope that you'll come back and join us on the radio show again in the near future and talk more about the great things that you're doing over at Advanced Vision and Achievement Center.
Thanks for having me.
It was great to have
And
you.
again, to find out more about Advanced Vision and Achievement Center, the website is www.advance-vision.org. And very pleased to have with us Dr.